Today we will be performing shoulder stretching during the acute pain phase. Watch as Dr. Michael Gialusis demonstrates the correct way to utilize a door to stretch at home.
Today we're going to go over the acute phase of a shoulder injury, which is just stretching at this point. And we do recommend, if we stretch the shoulder and it starts to hurt a little bit, always ice it if that occurs. So, treating a right shoulder injury, the first stretch we do is called a doorway stretch because that's where you do it, is in a doorway. So, Bill, if you could step forward so your feet are just in line with the doorway, just a little bit further back, perfect, right there. And you're going to bring your elbow at 90 and your shoulder at 90. So bring it just a little further down, and then you're going to catch the elbow in the door. And all we're going to do there is stabilize, so we're not moving the arm. We're actually stretching the shoulder capsule. So keeping the chest square with the doorway, we're going to move just about an inch or two. So move forward, just like that. No rotating the torso, just come forward just till you start to feel the stretch through here. And you hold it for 3 to 4 seconds on these. Try to go slow, because if you any bouncing, especially on the shoulder, could lead to further damage. And all we want to do is stretch all of those fibers out. And then as far as how many to do a day is going to be, yes, the more you do them, the looser it gets, the better it feels quicker. Alrighty. The second part of the doorway stretch hits more of the medial fibers and the rear delts. So staying in the same position in the doorway, Bill's going to bring both of his arms out straight and then just come forward. With these, we like to use both arms because it just keeps everything even and promotes a more proper spinal alignment. Same time, 4 to 5 second holds, and you want to get at least 10 of those in at a time. The last part of our doorway stretch is the pushes. This is going to help stabilize all the fibers of the rotator cuff. So once again, in the same position, Bill, I'm going to have you put your palms on the door frame, and all we're going to do is for 5 seconds at a time push with moderate pressure. You don't want to overdo it because you could flare up some of those injured tissues. But 4 to 5 second holds, and then relax, and 4 to 5 second holds. Once again, about 10 at a time. Give yourself a little bit more rest in between with these. And once again, if you feel more than just muscle tension, then take a break, maybe ice it if there is any sharp shooting pains going down either arm or up to the base of the skull.